Well, kind of hard to believe, but football season is already here and underway again.
It sure is, and that means athletes' parents and coaches need to be on the lookout for concussions. After the break, we're talking with a doctor about a new report out about concussions in Minnesota high schools and what this means for your son or daughter.
Well, concussions in the NFL are still a problem, and after the Green Bay Packers, they suffered a setup back during last night's opening game against Seattle. Running back Eddie Lacy, the latest to suffer a concussion now, the second year out of Alabama, left the game in the second half after picking up just 34 yards on 12 carries. Reporters actually caught him leaving the locker room later on wearing just sunglasses. No word on how long he may be out of action. And staying with the head injuries theme here, the Minnesota Department of Health out now with a new study on concussions in high school sports. And it estimates that during the 2013-2014 school year, nearly 3,000 concussions happened all across the state. Breaking that down, it's about 22 concussions per high school. Joining us now to talk more about that is Dr. Ben Baechler of the U of M Medical Center. Thanks so much for being here. You know, as you looked at that study, what were your thoughts on it?
The first thing was really the important takeaway that concussions are a leading cause of head injury in our youth in the state of Minnesota today.
Mm-hmm. And you were just talking a few moments ago that, you know, it's a brain injury. You know, a concussion is one thing, but it's really, you've done damage to your brain, right?
Absolutely. It's important for parents, coaches, and all of us to have an awareness that the term concussion, if we were to use old school thinking, they'll be fine tomorrow, they'll be fine next week. That is absolutely incorrect. A concussion is a form of brain injury, usually mild, but it is a brain injury. If I said to a parent, your child had a brain injury today in the field, they would take a step back and
we'd
say,
be a little
what?
shocked.
Absolutely.
Yeah, we would think about that, I think, a little bit harder. Now, one thing this study found is that 42% of concussions happening in boys, really not surprising. But when you look at this, when you stratify it out across boys and girls in similar sports, the girls actually come up with slightly higher percentage of concussions.
That is correct. And another important takeaway from this study is that when we look at participation rates, say we took boys and girls, put them in the same sport, that the girls typically would have just a little bit higher rate of concussion, just a little bit. But the important takeaway is that boys and girls get concussions, and if anything, girls may have them or be a little more prone to them.
Why? Why so?
Potentially there could be multiple reasons. Number one, I would say we don't have a full awareness of why this is. It could be related to equipment, it could be related to training, it could be related to conditioning, it could be related to diagnosis. So there's a lot of different factors. The difference between boys and girls in terms of the rate, if they were in the same sport with the same numbers of kids, was relatively small. Again, the takeaway is boys and girls get concussion. They get them at the relatively same rate, or girls even more.
Okay, so let's talk about age groups here, because Karen has got a son who likes to play football. I know there's a lot of concern among parents about, okay, my kids in the Pop Warner leagues or the smaller leagues, can they get concussions at the same rate as the older teenagers and college kids? And is there any difference in the symptoms that we should be looking out for in parents?
You bet. When we think about younger children as compared to older children, the younger kids, although the sport itself doesn't have the same type of impact or force or mass, these children may be at a higher risk of concussion because their bodies aren't as well developed to absorb. They may not have the protective musculature. Their equipment may not be as well fit as we find in, say, for example, in the high school leagues. When we have Pop Warner football, we've all been to those games. Some of the equipment can be a little loose. And so these children can be more prone. And when it comes to signs and symptoms, relatively the same.
Really? Okay. And quickly, I've just been given a rant here, but what are those signs that you should be looking for?
You bet. So we've all heard about, blurry vision, headache, throwing up, nausea, vomiting. Those are obvious. What we need to be more aware of are the softer signs and symptoms. A child who seems a little more dazed or lackadaisical, someone who's slowed in their responses the next day, that they're having difficulty answering questions, difficulty concentrating, difficulty sleeping, or changes in pattern. So it's a multitude. Know that a concussive syndrome can develop, and symptoms can last for weeks and even months. Every concussion is a serious concussion.
Man. Great topic to talk about. We'll be talking about it more, I'm sure. Dr. Ben Baechler from the University of Minnesota Medical Center. Thanks so much for being here.
Thank you.
Appreciate it.
You bet.